So, what is the difference between pharmacology and pharmacy? Well, pharmacy involves more the administering of drugs and the distribution of drugs. Well, in pharmacy, there's the PharmD program where a lot of people nowadays go for and become a pharmacist. It's actually required nowadays for you to obtain a PharmD program to become a pharmacist. And they do make a good load of money, but people usually confuse pharmacists with pharmacologists. They're two totally different things. I, for one, am doing pharmacology. That's my major here at Stony Brook, and I'm also on a pre-dental track. So, what is pharmacology? Pharmacology is more the research behind the drugs. Pharmacologists work with medicine, and they work with they work in developing new drugs, which the pharmacists later learn about and then they distribute. So it does make me mad sometimes when people are ignorant and doesn't know the difference between pharmacy and pharmacology. Unlike in pharmacy, in pharmacology, you don't. There's no PharmD program. To get a PhD, there's only a PhD program in pharmacology, and for that you need to go to a graduate PhD program after your bachelor's. However, in pharmacy, you could go to a combined program, 6 years, and be out, and be making 1,700. Not 1,700. What am I saying? Be making more than being making six figures a year, and that's great. That's awesome. But with the amount of pharmacists that are out there nowadays, in the outlook of pharmacists certainly seems like that it will halt at some point. Everyone nowadays is trying to pursue the pharmacist degree because they believe it's short, it's very convenient, and they don't have to become a doctor to make six figures. And even though I agree that it is very convenient, I feel that in the future this profession will halt at some point because the number of pharmacists out there right now is increasing tremendously. And the difference between pharmacologists and pharmacists is so great that they work in two totally different aspects in a company. While a pharmacist will actually work in the pharmacy and sell the drugs or give the drugs out, pharmacologist works in research buildings that they don't interact with outside people. They interact with other highly educated people in developing new drugs, and they do that every day. And they make a ton load of money too. However, they do a good amount of work for their money. And so, I am a pharmacologist. I am pursuing a degree, my bachelor's in pharmacology, and I find it pretty interesting, and I would definitely encourage people to look into it. But always remember, pharmacology is not the same thing as pharmacy. Later.